welcome to Menopause Rescue. I'm Dr. Polly Watson. Midlife women are often caught up in a sea of symptoms. Too often, they're overwhelmed by the lack of support from mainstream healthcare. They're inundated with so-called experts who are selling solutions which may lack credibility. I'm a Menopause Society certified gynecologist with both traditional and functional medicine training. I'm here to guide you through this transition and help you decipher the facts from the fads. Armed with credible information, I hope you are empowered to rescue and restore your health, making the second half of your life your best. Welcome to Menopause Rescue. Today, I'm your host, Dr. Polly Watson. I am delighted to have with me Dr. Elizabeth Cox. We're going to talk about something that is so commonly coming up in the clinic, which is that no one feels like their brain is working. So, Dr. Cox is a reproductive psychiatrist in private practice. Her practice is called Reset Health and Wellness in Raleigh, North Carolina. She specializes in treating women's mood and anxiety disorders during times of hormonal fluctuation. So, postpartum, perimenopause, Dr. Cox has been such a great resource for folks in my practice. She's been previously the medical director for the UNC Women's Mood Disorders at Wake Med North. And she's also been the residency education director for women's mood disorders at UNC, where she remains adjunct faculty. She has numerous textbooks and scholarly journal publications and have helped conduct trainings on postpartum support internationally to teach other clinicians. So thank you, Dr. Cox, so much for being with us and helping us get some clarity on attention issues and ADD as they relate to midlife transition.
Thanks so much for having me. Yeah, I'm excited to talk about this.
So a lot of women come in and as a gynecologist, I don't feel like I was trained or it's within my scope of practice to diagnose ADD.
Right.
And so one of the things I really wanted us to kind of drill down into a little bit is we understand that working memory is going to suffer as hormone levels are changing.
Mm-hmm.
And that might be different. Having a little bit of poor recall is different than a diagnosis of attention deficit disorder.
Yes.
So, can you kind of a lot of people are kind of using the term brain fog, and I know a lot of doctors hate that, but I think patients are just trying to communicate, hey, this is what I'm feeling. And
Yeah.
who the heck cares if it's an appropriate medical diagnosis? Like, it's not the patient's job to know that. So, can you kind of help us have a roadmap for what's the difference between brain fog or I'm having a little bit of a hard time focusing, I'm having a little bit of a hard time remembering that person's name versus a diagnosis of ADD? Can you kind of help try to drill down on that?
Yeah, sure. So, the prevalence of ADD in midlife, like later life, is thought to be a lot of this is controversial and we don't have tons and tons of data, but somewhere in that 2 to 7% prevalence I see. And so that's pretty rare. And if someone is wondering if they have ADD, I'm I'm not so much as much of a believer of like later life onset, but just something that may have gotten undiagnosed or overcompensated when they were younger.
Mm-hmm.
So when we're looking at that, that would be, did you have symptoms as a kiddo and what did that look like? And in childhood, was it interfering with your functioning and we can talk some about sex differences, which I know we'll get to too, but things can look different in a little girl versus a little boy. And so I do believe that somebody could have been overlooked and missed this and fall within that rare prevalence, and then we're not really seeing it and actually diagnosing it and treating it until later. So that is there. And to actually, the gold standard for testing somebody and or for diagnosing somebody with ADHD is psychological testing. So that's conducted by a psychologist, so a PhD, and that is usually like the bulk of what their work is. There are different psychologists that really specialize in testing. And so the gold standard again is like a full day, hours and hours of psychological testing to really be sure if that is what's going on. And that's oftentimes what we recommend to really be sure if a child has ADHD. And then certainly if someone is uncertain and I'm not really able to assess during my interview, then I will recommend seeking that out and really diving in to see what's going on. The other ways that we test, sometimes I'll just diagnose someone based on my clinical assessment. So
Mhm.
I'll do a full evaluation with someone where we're diving into all of these different symptoms and looking through. And if it feels like it fits the bill based on my clinical assessment and our interview, then sometimes we won't feel it's necessary to necessarily go down the route of the extended testing. There's also some clinicians that will offer some shorter computerized brief test,
Mhm.
but those are just not as gold standard. And there's different screening tools that can be used with questionnaires as well. But again, I'm using all of those questions within my own assessment for somebody.
Yeah, maybe you could kind of give people an idea, like when you're doing that assessment, what are some common things that are kind of coming up for you as like, oh, this person may actually never have been properly diagnosed as a kid? Because I think a lot of us as midlife moms are, we often have kids that did get diagnosed, and then we were kind of looking at their patterns and looking at our patterns and thinking, ha ha, apple didn't fall too
Yeah.
far from the truth.
Yeah.
Maybe this is something that that I've struggled with too, and maybe it's something that I've compensated for, right?
Right. Yeah.
And so I guess the first question would be like, can you kind of more specifically say, when you're in an interview with someone, what are some patterns or some attributes that you're listening for that make you think Houston, we might really have a problem?
Yeah. Yeah. So lots of times when someone has ADD, you can almost feel it when I'm with them in the room, like they're feeling scattered and they're having a hard time, even just walking me through what some of their concerns are. Like if you're really struggling with feeling distracted and all over the place, lots of times once you have experience like I do with treating these things, I can even like kind of feel like, okay, this I have a feeling, and let's dive into some questions. Again, another kind of indicator can be, yeah, my child was just diagnosed and tested and we're very similar. um, but looking back, for example, so we'll talk about what was it like growing up, and maybe they have a high IQ and they compensated well and they weren't like failing classes. The teachers didn't have concerns academically, but perhaps they got sent to the principal's office quite a bit for talking and for interrupting, um, or had difficulty focusing on things if they weren't interested and were like falling asleep during class, and couldn't finish a book. If somebody's like, I can't even listen to an audiobook. I don't have the bandwidth to even finish my audiobook. I can't read an article in a magazine. I can't read a book. Like I just get too distracted too fast. I'm starting all of these different things and I can't finish any of them. I'm forgetting everything around the house. I'm losing my keys all the time. All of these kind of present day concerns of having trouble juggling all of the things. And then we look back and they've always struggled with procrastination or meeting deadlines, um, those types of things
Mhm.
are some examples.
I totally hear what you're saying. I can remember patients that come in and they've got like a loose folder with 25 years of medical things, and but it's chaos, right? They kind of come in the room and there's like this bag of supplements that's sort of overflowing, and
Yeah.
this loose folder of records, and then when you're trying to take a history, it's almost like looking at a water wheel, the way the conversation goes. So they go from idea to number one to number two, and then they get distracted on idea number three, but we never really finished idea number two. And then we've moved on and we keep going
Exactly.
on in the water wheel, but we never like connected point A to point B. And so I'll be like, okay, I need to slow down. I need to go back to point one. Can we finish? I want to make sure I'm understanding. So I hear what you're saying about like sometimes there's an energy in the room
Yeah,
where it's just like,
you can feel it. Yeah. And it can make you anxious when
mhm,
so there's this overlap here that if you are not able to have proper executive function and you're feeling really scattered and then you start something you didn't finish and all this, then you feel like this undercurrent of things are not done and this unease and feel anxiety. So many times when we can appropriately diagnose and treat ADD, anxiety can go down. But the caveat is the treatments for ADD can also worsen anxiety.
mm,
And if you've misdiagnosed that this is ADD when it's not ADD, um, you certainly would feel panicky and much worse and much more anxious with a stimulating type pharmaceutical treatment.
right,
So it's very nuanced that the two can go hand in hand, and certainly anxiety can improve if this is the right fit diagnostically. But if we are off, someone could feel much worse. So
right.
it's important to try to nail it down properly.
I think that's so important. And I think from a physiologic health standpoint, it's also important. So when we're thinking about attention issues in kids, kids don't have a huge cardiovascular disease risk at that season in their life, right? But as we're approaching midlife, as we're getting older, our disease risk is increasing.
Yeah.
Then you've got later onto that, a lot of women will have this sort of fluttery heart. As estrogen is changing, they'll just have this, it's really annoying, it's uncomfortable. Is there something wrong here? What's going on? And then you're adding perhaps a stimulant medicine that can have some of those cardiovascular, rapid heart rate,
Cardiac, yeah.
stress on the heart, right? And so, one of the questions that I have is, well, one, we kind of established we want to get the diagnosis correct.
Yes.
If that's the correct diagnosis, how are we counseling midlife women with all this cardiac overlay where we're giving them a medicine that may make their heart rate go up, right?
Yeah.
And then menopause may make their heart rate go up, and then lack of activity may make their heart rate go up. And so, like, how do you manage or counsel people on kind of that secondary cardiovascular health piece associated with ADD medicine?
Yes. So well, first of all, if there is a history of cardiovascular disease, then we need to do an extensive workup and get an EKG and be sure that we are safe and have the green light to use a stimulant type of medication. If there is no pre-existing cardiovascular disease or concerns, then we can start it and just kind of monitor. And I'm just very conservative with starting somebody so that we can monitor for these effects and build slowly.
Mhm.
But a true stimulant, like a controlled substance stimulant, like Adderall, Ritalin, Vyvanse, those types of things, that is one pharmacologic option. But other options include sometimes if someone is having a mixture of some low energy and maybe a little bit of depressive symptom overlap, then they might be a good candidate for Wellbutrin. And that is like a fake stimulant. It's an antidepressant that increases dopamine and norepinephrine. And so that it can work nicely for a lot of overlap if someone's having a little low mood during perimenopause, low energy, brain fog. And it'll be much milder. It's not
Mhm.
controlled. We still do need to monitor blood pressure and things like that over time, but because it can, since it's stimulating, affect some people's blood pressures. So that's an option. Another option is often reserved for children, but I still do use a good bit of Stratera,
Mhm.
which is a little bit gentler and not a controlled substance and not quite as strong as a standard stimulant. And so there's a variety of options, but there's also the possibility that someone is experiencing I think a lot of women, especially if we think of this 2 to 7% prevalence. There's a lot of other people that are still struggling with brain fog and symptoms surrounding perimenopause, but they don't quite meet criteria
Mhm.
for ADHD, and they would probably not feel great on a
Mhm.
stimulant.
Right.
They may feel much worse. And so with that, I think thinking through lifestyle interventions is so key.
Mhm.
And you touched on before movement. And I think also that so much is put on us now. We're juggling so many plates. I think culturally, we're all addicted to our cell phones, and it's something I personally am working on in my own life. And this culture of respond immediately, be available at all times. There's not an unplugging. We're checking our email all minutes and hours of the day, responding to text messages. We're so hyper available that I think that that also truly affects your bandwidth and um, your mental state and your fog and all of that. Is too much going on. So I think kind of paring down um, and thinking through our to-do list and what we're asking of ourselves and what are your life goals and how do you want to show up in each day to be, all of those things can be really beneficial too. And thinking about what are we eating? How are we moving? Are you sleeping
Right.
enough? If your sleep is fragmented, that's going to cause brain fog, you know?
Absolutely. And, I love what you shared about the phone. I had a patient yesterday and she said, my phone is robbing me from investing in myself, my family, my community.
Yeah.
And I thought, wow, that's a profound statement, but it's so true for so many of us. And I tell my patients to do this, but I wasn't doing it. So I finally put my phone out of my bedroom. Now,
Yeah.
if I don't sleep well at night, I like to listen to Audible books. So I had a really it was really scary for me. So I put it in the walk-in closet where there's a door between us, and the
Yeah.
phone's on airplane mode, and it's 20 feet away from me.
Yeah.
I am sleeping through the night as a perimenopausal woman. I
Yeah.
am so delighted to be
Yeah.
sleeping through the night.
Yeah.
And it is
I
made
think it needs to be away from us. I agree with you. I put mine in my bathroom.
yes, yes. And then, also thinking about what about the lifestyle pieces? How is someone sleeping? We do a lot of blood sugar support, right? Getting a continuous glucose monitor and really making sure is your retention just the fact that you are one of these women that doesn't eat but one meal a day and you haven't fed yourself and you're dehydrated? Or are you sort of thriving on you didn't get good sleep, so you're having refined carbohydrates to fuel you and you're having these spikes? So kind
Yeah.
of looking at the whole picture. But I love that you're offering some gentler options because I have seen that where a stimulant started, we're perimenopausal, we're the sandwich generation, there's a lot of stress and anxiety, and it gets tipped the other direction to kind of chihuahua on the ceiling, which doesn't
Yeah.
feel
I mean, it can make you feel horrific if it's the wrong thing. So you just want to make sure, I mean, these are appropriate things to use. And certainly if someone's been suffering for a long time, and I've had so many patients that feel such relief
good.
and that
Hmm.
have legitimate ADHD that just didn't get treated. And sometimes the symptoms can be more severe. I mean, I've got someone that comes to mind who she didn't get treated until later in life, but she was really struggling in the morning. Another example of an indicator is how long certain tasks take you.
Oh,
Tasks were taking her 3 times what they would take somebody else. Just
uh-huh.
the simple things of getting up, getting the kids ready, dressed, out the door to daycare, lunch is made, was taking her hours,
Oh.
and she was late everywhere and couldn't get it all done. And she is somebody she uses, and we'll talk. So this is a good segue to this too. She uses lots of different tools of different apps that help for ADD and has done some coaching. And she's on a stimulant during the day, plus has to take an immediate release small dose of something before she gets out of bed in the morning at 6 a.m. so that she can get all the things done. And then she has success and does beautifully. But we had to fine tune with an extended release later in the morning, an immediate release tiny dose early on to get her the right fit. And then she's functioning quite well. But it's not just the medicine, it's also other tools. But these symptoms are very legitimate for her. And some of the sex differences that I think are important for us to highlight too. There's again it's not a great amount of data. There's not much of it, but it's likely that we think girls have more inattention
Mhm.
and boys have more impulsivity and hyperactivity. And that the girls likely also have higher rates of anxiety, depression related to this. So, and we think in general, there was a study that showed that girls are likely underdiagnosed. And another one that I read that found the ratio of diagnosis in communities was likely 4-1 in terms of boys to girls. So, I do think we want to advocate. And if somebody's missed a diagnosis and was suffering and struggling to be able to receive appropriate treatment, but also this fine line of then not pendulum swinging the other way, overdiagnosing and causing harm with medications that someone doesn't need to be on.
Yeah, I love your bringing that up because I think there's a lot of cultural bias that's coming into play. Like, I'm 51, so I was born in the 70s, right? Like,
Yeah,
I was the 6-year-old that went to school, went to the first grade with the house key around my neck. I was
yeah,
6 years old and I was letting myself into the house. That would not happen now,
yeah,
right?
yeah,
So, what was culturally normal for sort of parental involvement in the 70s was, if you're still breathing, it's fine.
yeah,
Here, have a TV dinner, right?
yeah,
Like, it was so different. And so we know so much more about attention issues. And we certainly still have a long way to come. But I think when I was growing up, ADD was just little boys, right? I mean, I don't know that there was a cultural space of a lens to see that girls could be having this
yeah,
issue. So,
yeah. There's stomach bias.
mhm.
Yeah,
Yeah, just the world is changed so much. So,
yeah,
I love that you mentioned this person using some apps. Do you mind
yeah.
sharing some of those? Because I
I
bet people
I
could.
need to reach out to find out exactly. I apologize. I don't know them off. She researched this and found these on her own. But I think what I do think is really helpful. So there are a couple of other approaches here. There are different therapists that specialize in ADD and executive function management. And then there's also separately from therapy, a coaching style. And so there's lots of practitioners out there also that are coaches that specialize in ADHD. And I also recently was made aware of an occupational therapist that specializes in executive function. Lots of times we see occupational therapy more with, like I've seen it more with individuals struggling with dementia and kind of helping them around the house in that way. But this is somebody that works with people, 30s, 40s, 50s that are struggling with ADHD symptoms and walking through life strategies at home, which is so important. I've had people tell me, I wish somebody could follow me around and like help give me guidance. And this is, I think, closer to that,
People in my family have ADD, and I guess a few things that I think have been remarkable. There's a little simple, maybe $30 clock you can buy on Amazon. It's called a time timer. And you turn the clock and it goes up to an hour, and then that part of the clock will show up bright red. And then very quickly, visually, you can see how much time you have left.
Yeah.
So if you're a kid that has a really hard time concentrating and your goal is to do your math homework for 20 minutes, you can set it for 20 minutes and at a glance see how much time you have left.
Oh, I
And so
love that.
that's been something we've used a lot just even since this person was little.
Yeah.
Um, and then if people are listening in Raleigh, our family's worked with an executive functioning coach named Colton Flick. And he's a young gentleman who I think is a fantastic fit if you have a kid that's really into like Dungeons and Dragons and games and that kind of culture because he works on game development to help kids develop executive functioning skills. So we get to tap into something that a lot of kids really like and then
Yeah.
help them with skills through that. So if you're listening and you're in Raleigh, I feel like Colton Flick has changed my family's life. I'm a huge
Well,
fan. I want to like paint it in the airways.
oh,
And
I
then,
love that.
yeah.
That's awesome.
So we talked about sex differences. We talked about some lifestyle things, blood sugar control, exercise, sleep, getting away from the technology. I think with that kind of also just sleep wake cycles,
Yeah.
natural light, those kind of things. Um,
Another thing too is caffeine.
mm,
So I think, when you're trying to focus more and you're trying to get things done, we can get in these patterns and cycles of just excess and too much. And then it ultimately, what was helping you a little bit starts to not be helpful anymore.
right.
So one thing I like to recommend is waiting an hour before you drink your first cup and trying to flush your system out a little bit more with some water or some lemon water first. And that can help too with some of the feedback loops. With our body, we wake up and there's a lot of adenosine and that makes you feel sleepy, and that caffeine can interact and have a feedback with that. And then it comes back later and you feel like you've got that afternoon dip and you need the next cup of coffee in the afternoon, and then you're sleeping like crap later.
Mm,
So that can help minimize how much your body's needing and reduce some of that. Or if you're just getting into a pattern, I know I love coffee, and you could switch out for decaf in the afternoon if you like the ritual of that.
mhm.
But those are types of things that, though they can help you focus somewhat, I think once we go too much, it starts to make you feel not good, and it's not helping.
Yeah, I can't tolerate caffeine. I'm too much of a spaz, but the counterculture coffee, that comes out of
Yeah.
Durham or Larry's that does the biofuel here in Raleigh, they both make great decafs that are brewed for people who drink coffee for the ritual, the smell, the taste.
Yeah.
So there's some really nice options. Decaf doesn't have to be disgusting.
Yeah, yeah, yeah. No, I mean, if I ever am getting a second cup in the day, I always try to make it a decaf. And even then it has a little bit of caffeine and you can still,
Right, right.
you know.
Yeah, so caffeine can be, and I think that's often a crutch folks are leaning on. Like when sleep is disrupted, it's just really hard to have those ideal health behaviors the next day because people hang on by their toenails, right? And so it can just really feed forward into making the next night's sleep worse. So,
Right.
so important to just kind of, okay, let's reset.
Yeah. And I think the other thing to think about too is, so if somebody's coming in with the brain fog symptoms, one thing that we would be remiss not to look at too is this, so you may not realize you might be a little depressed.
Hmm.
Sometimes it's clear and you can tell, and you are aware that you don't feel right emotionally, but um brain fog and trouble concentrating can be a feature of depression. Depression has a nickname of pseudo dementia.
Hmm.
Um, we see that more often when I was in residency and we would be working on the geriatric psychiatry unit, there may be elderly folks coming in that tested cognitively in terms of dementia. And once their depression was treated, all of their cognitive scores improved. So it really can mask and look like a thinking problem.
Hmm.
Um, and to know if that's going on, then we're looking at other screening for other signs and symptoms of depression. So things like, are you enjoying things as fully and as much as you typically would? Are you feeling more kind of sad? Are you feeling irritable? Changes in your appetite, um, excessive, unwarranted feelings of guilt, those types of things. But and sleep also can certainly be a symptom and impact it too. Um, so that's something else that to just be aware of.
Yeah, absolutely. I guess I have a question kind of relating to that. And so we all have sad days. Sometimes a lot of us are feeling really overwhelmed with the world right now.
Yeah.
Um and so back in school, one of the kind of things we used was, are these symptoms affecting your like daily quality of life, your ability to get done what you need to get done in a day? Are you not showing up for work? Sounds kind of extreme, but like, have you not opened your mail for a month? Or, all of those things. And so I've always sort of thought about using that kind of activities of daily living measure in terms of depression. Would you say that we're also sort of thinking about like your ability to function at the level you need to function with ADD also? Is that another kind of measuring stick, if you will, to sort of think about
Yeah,
how severe this is?
all of these things. It's so subjective. And so it's trying to figure out with someone, how problematic does something feel to you?
Mhm.
And when you think of your values and your goals and how you want your life to be on a day to day, is it impacting the way that you can show up in the world? Is it impacting your relationships? Um, for all of these things, ADD or mood. And for mood symptoms too, is it longer than 2 weeks? A bad day here or there, a bad week here or there, like that, can happen. But if it's really lasting a longer period of time
Mm.
and it's feeling problematic, I may have shared with you when we've chatted before an analogy I'll use lots of times. I use this regularly with anxiety, but I think we can use this for ADD. We can use this for mood, is a car analogy of that noticing these experiences or feelings or symptoms. It's just a part of being human. And so kind of noticing it's a passenger in the car, or it's like with you a bit, but that you're still driving and you're safe and capable of staying on the road. If it starts to feel like whatever the symptom might be is coming up in the front seat and taking over the steering wheel, and you feel at the symptom's mercy, and you no longer feel like you are in control of showing up in your life the way that you want to, that's a question mark of something seeming problematic to me.
Yeah, I think that's a great analogy. I think kind of to wrap around with that is just that we see this in kids a lot, and maybe kids or even adults, that people who have a high IQ and they've functioned at such a high level that they may not present as early as someone who maybe doesn't have as much bandwidth there. But I
Mhm.
feel like at midlife, it's a time when executive functioning is really tested in terms of, we're often pushing up against the ceiling in our career. We're managing elderly parents. We're managing kids. I mean, going through the college admission process. Holy crap. Like, I mean, when I went to college, I don't even think my mother read my essay. Like, it just wasn't such a big deal. And now it's just like you're hiring coaches and all this crazy. And so I sort of feel like this is another time where someone may have been able to manage with either skills or adaptations or whatever, but the pressure of the situation is just much higher. And so maybe some of this is going to show up where the dog is driving the car now.
Yeah,
Right?
exactly,
We're
exactly.
trying to drive the car. We're
Yeah,
trying to drive the car, and we've got a pack of wild rabid dogs in the
yeah,
back seat,
yeah,
right?
yeah, yeah.
That's awesome. Anything else? Anything else we want to make sure we get covered today?
I mean, I think we hit most everything. I mean, I think when you think of brain fog, I think thinking through back to the blood sugar and all of that, like if someone's not feeling right, making sure we're looking at all aspects of what we're putting in our bodies and how we're moving our bodies, how we're sleeping, like those are some of the like basic cornerstones. And then if things are really bubbling up to the more problematic, that knowing that you deserve to be able to investigate this, see what's going on, and that there are different options, whether that might be medication management or coaching or apps, but there's all kinds of different things that can be done to help with these concerns. And just because you weren't diagnosed when you were little doesn't mean that you don't have that you
Right. And that there's help available.
yes.
Like I love that there's help available. And some of these side effects sound really scary. And that's why we want to work with experts, right? That's why we
And they
want to work with.
needed, right. Yeah. And just because, and if you are diagnosed with this, like let's say we met and that is the case, you don't have to take medication for it. We can talk through other alternatives
Mhm.
as well. But just that if you're concerned and you're struggling, like there's help available and there's lots of different options.
I love that. And so there's coaching. We obviously want to make sure nutrition, lifestyle, sleep, blood sugar support. There's alternative medications and straight up stimulants. So maybe like an activating antidepressant like Wellbutrin, medicines for kids like Strattera that are a little bit less strong, that aren't even a controlled substance. And so I think this just really gives people a lot of freedom in the sense that this is very treatable and there's way more than one way to address the problem. And so I think where maybe people may have some hesitancy, oh my God, I would never take Adderall. Well, that's fine. There's,
Yeah.
there are several other things that you could do, and many of them aren't even medications. So it's
Yeah.
fantastic that there are doctors like you that are really helping partner with patients and giving them so many choices so that we're helping that patient feel so much more empowered in a season of their life when they may be feeling like they're not driving their own car.
Yeah. 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 It's a hectic season. That's for sure.
Yeah. Well, thank you so much. This was
Yes.
great. I really
Yeah.
appreciate it.
Yeah. Thanks so much for having me.
Have a great day.
You too.
Thanks for listening to Menopause Rescue. We hope you've enjoyed this podcast and it helps you create some time and space to make this the best half of your life. If you've enjoyed this content, please leave us a 5-star rating and review. This helps other listeners find this resource and rescue and restore their health. If you enjoyed this topic and want to learn more, check out our resource guide for this episode. If today's podcast resonated with you and you want to take a deeper dive, check out my educational resources. We offer basic membership, which is an archive of over 100 videos on menopausal topics ranging from bone health to libido. We add to this archive every month, so the resource becomes richer and richer over time. If you're looking for a menopause expert and live in North Carolina, take our free online class and see if we're a match for your needs. It's called Are We a Good Fit? And is a quick and easy way to learn more about our practice and what it has to offer. Hey, this is Dr. Watson. This is just a friendly reminder that this podcast is for general information purposes only and does not constitute the practice of medicine. No doctor-patient relationship is formed, and any information you get from this podcast is considered educational only. You should make medical decisions with your healthcare provider. The content of this podcast is not intended to be a substitute for professional medical advice. Listeners should not disregard or delay in obtaining medical advice for any medical condition, and they should seek assistance from their healthcare professionals.